Welcome back. This is Healthwise, your informative and educative health talk show. I'm so delighted to introduce to you in the studio the Honorable Commissioner for Health, Lagos State, Dr. Olajide Idris. Thank you so much for coming, sir.
My pleasure.
Thank you, sir. Thank you so much. Beside the Honorable Commissioner for Health, I have Dr. Abidoye Sunday, is WHO State Coordinator. Thank you very much for coming, sir. Thank you so much.
Thank you, Presenter.
I have Dr. Jemilade Longe, is the Director of Disease Control from Lagos State Ministry of Health. Thank you so much, Dr. Longe, for coming.
My pleasure.
Now, Dr. Olajide Idris, please, can you educate us on this Ebola virus?
Well, Ebola virus, for the benefits of the school children, a virus, we call it a germ. It can come in various forms, but this is a particular virus. You have viruses, you have bacteria, you have fungi, all germs. But this virus, I think you cannot see with your human eye at all, except through the microscope. It causes disease. This particular virus, in the sense that it was first discovered that it infected some animals, like the fruit bats, a long time ago. And again, as like chimpanzees and monkeys. That's what the literature says. However, it first spread to a human by contact of an infected animal to the human. And a human-to-human contact can only occur if a human being is in contact with the secretions of another infected human being. What we mean by secretions, it could be saliva, it could be sweat, it could be vomitous, it could be blood, and it could be urine. That anybody who's infected, all those fluids in the body are generally infected. They have those viruses. So if another person comes in contact with these secretions, the person is likely to get Ebola. The Ebola virus, it presents in a way that the common problems we have here in this country, they present in a similar way, just like malaria, typhoid, even your normal flu. They present in a similar manner. You can have fever, you have body aches, you have joint pains, you have nausea, but again, you can now start vomiting and having diarrhea. Many diseases can present like that. But for Ebola, if it continues like that, you can start seeing blood in some of these secretions. So your vomiters may contain blood, the urine may contain blood, the stool may contain blood. And again, they bleed internally. And that's why it's very, very dangerous, because if you bleed internally, you may not know until it's too late. And that's about anybody who has the virus, it's not contagious, it's not infectious until those symptoms start manifesting. And the first symptom that it can manifest is just fever. So what we are doing as a state government is, those of them we feel are contacts. If you recollect again, this virus was introduced into Nigeria by one Mr. Patrick Sawyer, a Liberian, who was infected. But as it came into this country, nobody knew that he had Ebola virus. So the first group of people who came into contact with to help him were those people now that came down with the disease. And luckily, he came from the airport. They tried to help him. The people who tried to help him from the ECOWAS were some of the people who had the disease. Then when they went to that hospital, the first consultant, all the doctors and nurses who came into contact the first time, because they didn't know what he had. The virus is very, very contagious. So I've told you how it presents. And that's why when it first came in, the first thing we did was, unfortunately, the man died. And a dead Ebola patient is even more dangerous than a live one, because the virus now can multiply quickly. And that's why the first thing we did was to ensure that we decontaminated the body, we bagged it properly according to protocol, and buried him. That way, we reduce the source of contact. The next one now was all the people who had been in contact with him. We had to trace them, because it was very, very essential to trace them. Tracing them, that's the only way you can curb the virus. Sure. You need to trace every single contact. So what we did was, even all the contacts that were with him on the plane, on that flight to this scene, we got their names listed, their numbers. All the contacts, all the people who came in contact with him in the hospital, we got their names, we traced them. And what we normally do is that if you are a contact, we counsel you, explain to what Ebola is, how it can present, And they need to watch out for the symptoms. And each one of them was given a thermometer.
Okay.
The thermometer was there to measure their temperature twice a day, morning and evening. Any one of them that had a temperature above 38.5, we brought out from the house, because now they can get very infectious. So we brought them out and put them in isolation. So to answer her question, what and what have we put in place? We put in place so many things. We created a team of contact tracers. That's their job. They will go to every house, they will be in contact with every contact by phone, every day, twice a day. Hello, Mr. X, what's your temperature today? What's your temperature in the morning? What's your temperature in the afternoon?
Wow.
If you say the temperature is normal, we say okay, but try as much as possible to move away from people who live in the house. If possible, move them. Because you can't put everybody in isolation.
True.
But once the temperature goes beyond that level, you have to bring them out of that house or community, take them to isolation, then decontaminate the house. Because to prevent infection. So the next group of people who have been in contact with this group are now called secondary contacts. We have to list them again and follow them up just like the first one. And to answer a question, the major challenge we had was, if you recollect from Liberia, Guinea, and Sierra Leone, a lot of people died. That's because a lot of people ran away from these people because everybody was afraid that this is Ebola. And because they did not know what to do, how to protect themselves, they left these patients to die. We have tried to reduce that. We are still trying because fear is one. Everybody was scared. So one of the challenges we had was getting people to do contact tracing, that is to follow up all these contacts, getting people to look after those people that actually confirmed cases in the isolation ward. And that's why the state government and the federal government came up with the idea of asking for volunteers, and we had to give them incentives for them to be able to work.
Thank you so much. Thank you very much, Dr. Olajide Idris. Thank you very much, sir. Now, Dr. Sunday, let's talk about the role of WHO in this situation.
Yes, thank you very much. The World Health Organization is the UN arm of the United Nations that supports government to ensure the good health of every nation in the world.
Okay.
In Nigeria, we have been able to also support the federal government of Nigeria, as well as Lagos state government and other state governments to ensure that we contain this Ebola disease outbreak. In the first instance, you realize that after we have identified or established that there is an outbreak, the next was to ensure that we play a leadership role, setting up the standard that is supposed to work. And this standard was also broken into groups and pieces in which WHO play major role in all those groups. And I will tell you those things. One, the leadership role we play is to lead other arms of or groups of or organizations to support the government in full measure so as to ensure that we have all the necessary personnel in all fields and give necessary support.
Okay, that's good.
Number two is that we are entered into case management because you realize that Ebola virus disease has not occurred in Nigeria before. So, but for this one, we have to support the state government with the technical know-how that is needed.